Welcome. This is Leanne Meier, and I'm the host of Once a Nurse, Always a Nurse. And I guess we're actually more recently been calling it Once a Nurse, the original, so that you can find these new shows that are showing up on the podcast platforms. Today's show is really, really special to me. I've been wanting to talk to my guest for at least a year, and it just hasn't happened yet. So this is the time we were able to do it. And we want to be able to do it for Nurses Week, because what I've been really striving for, especially over these last 3 years, we hear so many of the negatives. And so many times what I've been looking for are who are the people that are doing things well. And definitely my guest today fits into that category very, very well. So, and my guest is Dr. Carol Biggs. She is the Senior Vice President and Chief Nursing Executive Officer for Jackson Health System in Florida. Huge job, a huge job. I have nothing but admiration for you. In the course of our conversations, one of the things that I've always felt is just tremendous admiration for people who fight from their hearts, even when things look like the odds are against you. And I think that, people like yourself see opportunity where others see disaster. And I'd like you to be able to share with us some of that. Nurses need to fit into that category. We have to have the optimism of knowing that there's opportunity and disaster in everything, and we can focus our attention where we choose to put it. You have just done that again and again and again throughout your career. And so I'm hoping we can get into that. You have done so many things, excuse me, worked in various different places in the country. You've always been involved in hospital healthcare to the largest extent. I think you had a clinic also that was involved in oncology, if I remember correctly. You can correct me on these if I'm wrong. But you came from Jamaica. You came to the United States. You just stepped up. And even you had mentioned to me that in high school, when people would ask you to do something that was huge, you would say, oh, okay, sure. And so I'd like you to share with us a little bit about that. So right now you are also an adjunct faculty member for the University of Miami and the Nicole Wertheim College of Nursing and Health Sciences in Florida at Florida International University. I don't know where you find the time to do these things, but it's so very important. And you're an active member in a number of nursing leadership organizations, the American Organization for Nursing Leadership, the American College of Healthcare Executives, and an associate member of the American College of Cardiology. You have received many honors. I'm going to just ask you to talk a little bit about those a little bit later as we go along. But what I really want to do, and I ask every guest that I have, please share your story. So I want to welcome you to the show. And then I would love you to share just kind of briefly what your journey has been that's brought you to this place at this time in history.
Oh, thank you, Leanne. Thank you. Thank you for having me. Yeah, it's a pleasure to be here, especially on this week, Nurses Week, right?
Yes.
And the ANA made the theme for this year, Nurses Make the Difference. You make the difference.
Yes.
And it's never been more true than right now in the various challenges that nurses are facing, the healthcare is facing, hospitals are facing. Coming out of COVID from a pandemic to an endemic. And, at this point, with the nursing shortage, we've always had a nursing shortage, right? But the nursing shortage that we have now, if you read all the research and the literature, it's pretty daunting where, the numbers are just growing exponentially as to the deficit, but we can't just focus on the negative. While we have to face our reality, that is the reality, the
Right.
numbers are the numbers, we really have to look at, okay, that's it. So what are we going to do about it? How are we going to not only survive it but thrive in it?
Mhm.
So that's really the position that we have to take, as nursing leaders, and as leaders and as nurses. And as I like to say, every nurse is a leader.
Yes.
So every nurse does have to, we all do have to look at this and say, okay, this is a profession that we have chosen. We do this for a reason. We have a passion for it. People come to us when they're at their worst. When patients come to the hospital, nobody comes to the hospital voluntarily, right? Everybody comes there because they have to. And they really put their trust in the nurses to really do what's best for them. As nurses, we, again, not only do we see people when they're at their worst, but people trust us with so much of their of giving of themselves. They trust us with everything. They trust us to do the right thing for them. They tell nurses things that they don't tell the closest members of their
And
family.
may never have told anyone else before.
Exactly,
I'm sure
exactly.
that's happened to you. It's happened to me many, many, many times.
Absolutely. And we have to honor that trust, right? And make sure that whatever whatever we're doing, whatever is going on in our own lives, because we're human, we have the same challenges that everyone else does. But while we're there with that patient, that person is our priority. That
Yeah.
is why we're there in that moment. We just have to be in that moment with each and every patient.
I think you probably would agree also is that for the most part, the public has very little idea many times of what nurses actually do. I came upon this realization when I was in my 30s, and I was trying to explain to somebody, you can't imagine what a day at work for a nurse is like. And especially if you're in, critical situations, emergency room, all of those kinds of, I was an OB nurse, so there were plenty of critical situations that came up there. And you might be the only person there if it was at night or, something where you had to figure it out. You
Right,
just had to figure it out.
right,
Use every resource that you have. The thing that I feel like is so important, one of the things I've been trying to do is to get nurses' voices out there so that people do know, they do have a sense of what it is that we're doing. And it's not just about tasks. Many people may think they know the tasks that nurses do, but it's what you were talking about, those moments with patients where um, they share something so very deep, and it like opens up an aha for everybody that's caring for that patient. All of a sudden it makes sense. No wonder this is what's going on, and we can go from there and take a new direction with the person. That doesn't happen without spending time with that person, and that can be while we're doing other tasks, but for the most part we have to have our attention there. I'd like you to talk about, let's back up just a little bit. I want you to tell your journey from Jamaica to where you are now in like 5 minutes. Can you do
okay. 5 minutes or less. Okay.
that? Okay.
So migrated to the US when I was 10 years old. And we were in New Jersey. So grew up in New Jersey, went to Rutgers University, College of Nursing. I left New Jersey as a 6 months old nurse because it was just too cold. Relo-
I'm from Minnesota. I can relate to that.
yeah, there you go. So relocated to Florida, and while in Jersey at Rutgers, we did have a program called the Nurse Extern, where you were able to work at a hospital, the university hospital, which had an affiliation with Rutgers. So we could work there, and everything that we have already passed the test in school, we could actually do under the auspices of the RN we were working with. So it was a great program where you really got to really practice what you already learned academically. You were putting it into practice. So by the time we graduated, those of us who participated in that program, our onboarded or orientation
Right.
to into the RN role was very short because we were practicing already. So after 6 months, I moved to Florida, and I chose to work at Jackson Memorial Hospital at the time because that was what was closest to the university hospital that I was trained in and accustomed to, and it was really the best decision because the things I saw at Jackson in the first 5 years that I was there, I have never seen again since I left Jackson. Um, and the learning was just exponential. And because I do like to learn and I like new things, while at Jackson in 5 years, I actually was able to, become a certified oncology nurse. Did It was during the AIDS crisis back then, so our floor was known as the special immunology floor. We opened a special immunology clinic, so a lot of learning, and that happened during that time, and also a lot of you really learned how to really have empathy and really develop that relationship with your patients. When you're taking care of someone who is so frightened because of a disease that we don't know what was going on with it, and you know the various methodologies of how it was, the transmission, I really had an impact on me as a person and as a nurse. And remember back then, when we were working with those patients, you couldn't even tell anybody that you worked with those patients because then they would scorn you. It was really a serious time that we went through. So it was even more of a bond, especially with us nurses who worked in those areas.
Yeah.
And then, then
Came to love the patients.
oh yeah,
Mhm.
it was, and the learning was so amazing because everything was experimental, right? So
Yes.
we're working with the physicians who were on the cutting edge, and also the different treatment because I was an oncology nurse, and the various Kaposi sarcoma and other things that so we would treat with chemotherapy. So it was really,
Mhm.
really a scary but very exciting uh,
Mhm.
time. And from there, I left after 5 years. I was recruited over across the street, which was Cedars at the time, and there, and there, as I shared with you, I'm like, okay, I'm not going back into leadership. I'm gonna just be a staff nurse. I had little kids growing up, and but then I ended up back in leadership
Yeah.
uh, as
And
a.
say a little bit about that. That was quite a role for you at that point, wasn't it? Do you want to talk a little bit about that?
Well, yeah. I was a staff nurse, and even though they recruited me because I was an oncology nurse, but I ended up on cardiac tele, and it was just my way that I would go in because when I'm working as a staff nurse, I like everything in place before my shift starts. I like that once I start, I'm off. I don't like
Right.
the hiccups, and so I would go in early and get everything set up, make sure the supplies were there, everything stocked my rooms and what have you. So when the assistant manager position came up and my manager asked me to take it, I'm like, no, 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 I'm good. I don't want it. And finally, she said, if you don't take it, somebody else is going to come in here that you're not going to like. And I'm not going to do anything about it. You're going to have to deal with it. So, so,
Ooh, that's kind of a threat.
so yeah. So with that, not only did I take it, the other staff started going, Carol, you better take it. You better take it.
Yeah.
So then, yeah, I did end up being the assistant manager there. And then got promoted to manager, opened up a new unit because I really do like to create things. I like to open new things and work with the interdisciplinary team to put it together and watch it grow. So we opened up the university service there, the hepatology and dermatology floors there. Again, something I knew nothing about, right? I
Yeah.
was cardiac tele, and then
Yeah.
I was
Figured
oncology.
out as you go. Yeah.
But again, that is the exciting part. And that's the beauty of nursing, right?
Yeah.
That's the beauty of nursing, that you can stay in this profession and do so many different things, so many exciting
Sure.
things, meet so many various people, and impact
Hmm.
so many lives. And from there, my CNO left Cedars and went to South Miami and recruited me to be the a director at South Miami. And as I shared with you, when I went there, I was one of four directors, and then
Yes.
shortly after, there were only two of us,
Yes.
and
Funny how
I
that
went.
works.
Yeah, I
Same,
went.
same caseload, same amount of work, just doing it two
Yeah,
people instead of
yeah,
four. Yeah.
there you go. Yes, I went to be the med surge director, but became med surge critical care and ED, which again just opened up other worlds for me, other learning, and able to make an impact there. And then while I was at South Miami, it was great because again, my CEO recognized that I'm not going to say I get bored easily, but I liked once I've mastered something,
Right.
I like give me something more to do. And so while I was there, I became vice president over Imogen, and which was again a whole new learning, was amazing. And then developed the what we named the South Miami Heart Center, which are the six cardiovascular service lines. And again, that was a very dynamic and um, interesting thing to do, working with six different
Right.
strong-willed
Egos
physicians.
and ways of doing things, and yeah, all of
Yeah,
that. So you have to kind of meld all of that. You and I have that in common. It seems like that we like that challenge of taking a puzzle and all the pieces are just scattered, put them all together. And then once the puzzle is in place, it's kind of like, looking for, okay, what's next? And it's not so, like you said, it's not really boredom. It's that once it's all routine, then it's really that desire to have that next challenge. So you talked about being able to bring people together. And so not just the cardiologists, but also the nurses that were working there. It was a pretty new concept, right? So everybody was learning together. How did you bring, um, I know that you have a skill in making not just patients trust you, but I think everybody that you meet probably gets the sense that you're on the level with them, that you are going to be straightforward with them. They can trust you and they can tell you what they need to say. Um, how did you come by that? How did you learn that? Is that something that was innate for you, or how did you come
you,
to that?
it's I I didn't even realize that that's what I did till somebody brought that to my attention. Because for me, trust is always important.
Hmm.
Trust is very, very important. And I am a cup half full person. So I trust openly until you prove to me that I shouldn't.
Right.
And I do believe 95% of people are good. Right? And that has not been disproven to me.
Hmm.
So I come with an open heart,
Hmm.
right? And I I don't know how to be anybody but me.
Hmm.
So it's not, I'm not able to put on airs. I just don't have that ability. I'm not saying like I can fit into a situation for 30 minutes. If I need to sit somewhere and be totally formal and
Sure.
keep my chin, I can for 30 minutes. After that, then you know, I'm back to
Then the real you comes through.
exactly,
Yeah.
exactly. So I think people see that.
Yes.
And also the thing that I pride myself on the most than anything is that when somebody tells me something and say I am trusting you with this information, they you never hear it from me. It is like because to me, I see that as they just needed to get that off their chest. They just needed to be able to have another human to relate with for that moment. It's not my information, it's theirs.
Hmm.
So I pride myself in that. and I believe that that's something that people also see in me. And
The other thing that
um,
I pick up from you, and I had an opportunity last summer to have just kind of a very quick meeting with you and two of your CNOs, and I think you described them as kind of your sisters. That the three of you worked really well together, and what I noticed from there was the respect. It was almost palpable, not just between them toward you, but you definitely toward them. How does that make a difference in the work that people put out? It's like, how I think it almost makes people different, makes them their better self.
yeah, absolutely, because again, when my philosophy is that we all sit at a round table, right? That there's no head at the table. We're all round. We're all on the bus. We might be in different seats on the bus, but
Mhm.
if the wheels fall off the bus, none of us are going anywhere, right? We're all on the same bus. And I think it's important that no matter what your title is, you are you are being paid to do a certain job, which is part of the greater good. Your job alone is insignificant if everyone else isn't there, right?
Mhm.
I used to tell my nurses when they would say, "Oh my God, this place is so full, the admissions keep coming," and I would say, "Consider the alternative. We'd be complaining if our beds were empty and people have to stay home." And so I said, when the beds are full, it's a good thing, guys. We'll just all get in there together and make it work, and I'd get various looks, and what have you, but they would know. And sometimes they would, when they're about to start saying, they're like, we know, okay, it's
You've
the
heard this. This is lecture
yeah,
number 101.
yeah, it's better
Yeah.
than the alternative. All right, all right. But I think also my staff and my team members always know that I am always going to pitch in, and I'm
Mhm.
always going to, and I will, another I have a few philosophies I live by. I will never ask my staff to do something that I won't do.
Yeah.
If I'm gonna ask you to get on the ground and clean the grout with the toothbrush, I'm
Yep.
gonna be right next to you with my toothbrush, both of us cleaning that grout because Joint Commission is at the door. Whatever, we so that's and I don't just say that, but I do it instinctively
Yeah.
sometimes, without
And Carol, whether you realize it or not, that is what, I'm talking to nurses all over the world, all over the country, but also all over the world. And what they're telling me is they don't see that to a large extent. They see their nurse leaders often as telling them what to do, but not really supporting them. And that is clearly something that's important to you. You've been just talking about how you're the kind of person, when there's a puzzle in front of you, you get excited instead of saying, oh no, another puzzle to put together. So you were exactly the right person in exactly the right place when COVID came along 3 years ago. So you had a big puzzle. Again, like some of the previous things that you had jumped into, we didn't know. There was more that we didn't know about it than what we did know. So how did you approach that? How did
well,
you personally, but then how did you encourage your nurses to be able to put this puzzle together with you?
one of the things I have to say, Jackson Health System did a phenomenal job, as the entire system. This is one, when this happened, everyone from the CEO of the entire system down to the environmental worker and groundskeeper, everyone stopped and paused and go, what are we going to do? Everything, it really taught us too how agile we could be. When normally something would take 3 6 months to initiate, you would
Right.
ask for something. I remember the we were having meetings probably like 3 or 4 times a day.
Yes.
We were meeting on the
Changing. Everything
weekend.
was changing every hour.
Yeah, exactly. To know what are we going to do, how are we going to do it. There's one thing that we did. We had to put together the this process so that nurses, well, not nurses, staff could test themselves before coming put in their data into the system before coming to work, and it would tell them whether to come or not and what have you. And it was so agile. I don't even remember who had the idea, but myself, the ED director at the time, Monica, and Tala from our benefits department, the three of us got together and we thought about what we would want. And Monica being the ED was the front door for sure. Um, and we worked with the ED physicians, like what should be remember, we didn't know what all the symptoms you should be looking for back then, right?
Exactly.
We were learning day by day, week by week, and working with the ED, our ED medical director, and then Tala got IT, and we built an app, so that, and then it would go straight into our system so
Yeah.
that you could see, and the ED tested it, they were the pilot, and we were just able to make changes like that, and we're like, wow. Now we sit back like, I wish we could do stuff like that all the time.
Right.
But our entire system really went into automatic mode. And even I don't know if you're aware, I think Tanya might be aware, but Jackson Health System, we became one of the main places where we were given, once we got the vaccine, we were given the vaccines right there at Jackson. And we were out doing a lot of talks. Of course, they were all over Zoom, to educate our community. And it was really a dynamic process. Now, for the nurses on the units and the floors, they were really, really struggling again. It's hard to believe it's only 3 years ago, but when it first started, a lot of people were not going home. So the
Yeah.
hospital actually worked to find, a lot of hotels were closed, so could get some of those rooms so people would not have to go home. The physicians and nurses were staying different places. People would talk about how they set up a shower in their backyard. They would, yeah, they would strip in
Works
the
in Florida, not in Minnesota.
yeah, right. Yeah. Well, here in Florida, yeah, they
Yeah.
would, take off their clothes in the backyard, shower, and go in. And the hospital was really fantastic in you know, working with staff. Also, with we would just round frequently with different goodies, healthy food and unhealthy,
Yeah. Yeah.
whatever
Yeah.
people
Sometimes
wanted.
you need some of both.
Some
You
cookies,
mentioned that you learned early on that food is the universal draw.
right?
Everybody will come and do almost anything for food.
Absolutely.
So,
So
and then there have to be times when the staff, whether it's nurses, of course, I'm focused on nurses, couldn't get away, to run to the cafeteria. So, how did you handle that?
yeah, the same thing. We would take food to them. We would work with the nurse manager and say they have to get a break, even for sometimes people we would just bring food up to the unit because some people just did not want to leave.
Yeah.
At one point when we started asking them, tell us what you want, because we kept trying to give them what we thought they needed or wanted. And then after a while, we started asking, what is it that you want? And I remember some nurses said, if we could just have a place to just go for, 5, 10, 15 minutes. So actually, we set up some tents outside in the grassy area and just put some chairs under the tents, open tents, and people could just go down there and sit for 5, 10 minutes and, get a breather
Yeah. Get a
away from the unit.
refreshment.
Yeah,
So
yeah.
what I'm hearing you say is what you did was support every single nurse where they were at, and you heard them. And so many of the nurses I talked to across this country never felt heard. In fact, they were beaten down. Anything that they said, they were just like, go away, don't talk about it, don't complain, just keep working. You can't, I mean, we give of ourselves when it's a gift, when we're giving it because we're trusting and caring about the people around us and we know that everybody is struggling. That's when we have that cohesiveness. You seem to have that in your heart, in your life, that is true.
Well, again, nurses are humans.
Mhm.
We know that during the pandemic, probably like halfway in, we were hearing statistics that anxiety, depression, mental health is up 40%, right? Then you were hearing 1 in 4 people, and all these stats. Well, nurses are 1 in 4 people. Nurses are part of that 40%. So, and we also know that you can't give what you don't have.
Right.
So, we all have a cup, no matter what size that cup is, it is limiting. Once the We can't expect our nurses to continually pour from their cup. When it becomes an empty cup, somebody else have to pour into them, and that's the job of a leader. So
Yes.
as a nurse, as a nursing leader with a title, this is a title leader that I'm talking about. It is our responsibility to see when somebody's cup is empty and go, whoa, whoa, hold on, let me get you, let me get you a little refreshment. Because how then do we expect them? The ultimate person we want cared for is the patient. We can't expect that nurse to give the care we want them to give, or we expect them to give, if we're not caring for them. So, I mean, we all have a job to do. We
Right.
all have a job to do. So that's like very important to me. There's one thing that really troubles me, I guess I should say, is whenever I go up on a unit and I see the unit, it's, you know, it is hot, things are going, people are
Right.
everywhere, no one can even say hello to you, lights are going off, and the nurse manager is in his or her office.
Yeah.
That's the one thing that I really, really cannot handle. That, you know, because if I'm up there, I'm going to be answering some lights, right? Because the light, I have a philosophy: light should not ring, phone shouldn't ring more than 3 times, and light should not go off, more than a minute before somebody should be in there. So I'm going to answer it and do whatever I can. Then I go look for the nurse manager. When they're off in their office, I usually say something like, "Have you been out on your floor lately?" Or something like, "What's going on out there?" Or I always ask a question. I never assume I know anything, right? I always ask a question.
Yeah.
You
It
know,
may have been the first time she moved into the office all day or in 3 days or something.
right? Exactly, exactly. Maybe she had a patient assignment herself. So I never assume like, "What's going on? You need me?" or or something like that. So no, that's as the nursing leader, it is our responsibility from the A&M all the way up to care for the nurses.
This is like the epitome of integrity that comes from, partly I think, it's almost innate. Some of us, that's the way we were raised. That's, we just assume that. Some of us learned it in nursing school. And, we watched it modeled. We saw people doing that and we knew, yes, that's what I need to do too. I'm amazed at how much that's not necessarily the case across the country right now. What, how can we relearn? How can we teach? What has to happen going forward? And maybe I guess my question to you is what do you see needs to happen going forward to either recreate or reaffirm or somehow solidify hospital care so that nurses want to be there? Nurses feel like this is who I am and this is supporting what I want to be.
So that's a loaded question, Leanne, because there's so many parts to it. It's an octopus. Um, the document, Nursing 2030, actually speaks to this, where it speaks to the fact that we really have to start from the nursing schools, right? The hospitals and the nursing schools have to work together to we as the hospital need to understand what is the curriculum, and we need to have a partnership with the schools to ensure that that curriculum is going to match what is needed in the environment. Also, the schools have to address the students' well-being, right?
Yes.
Now, when the students come to the hospital, we really, and this is something we're actively working on now at Jackson, we really have to teach our nurses how to work with the nursing students. We
Yes.
I think we assume a lot. We assume that the nurse, well, you just came from nursing school 2 years ago, 3 years, no, you don't, right? We just assume, why don't you know? Yeah, just, you know. So we have to stop and intentionally and with purpose say, this is what you do. One
Exactly.
one of the things that we realized when I started looking into this is that the manager and the nursing team on the floor does not even know where the students are in their learning. So they don't even know that they've already passed fundamentals or where they are. So it's like a total disconnect. We've got to get that connected to know
Right.
that this is where they are and this is what they can do.
Hmm.
And, so that's a big piece of it. Also, healthcare is notorious for promoting people
Yes.
because they were a good clinician and not
Yes.
in them.
I was one of them.
So
Yeah.
so yeah, and some people will go out and self-learn, right? Will seek out,
Mhm.
knowledge. I'm going to be doing this now. I need to learn how, or
Yeah.
seek out a mentor or some, but not everybody would. A lot of people think they promoted me, so they must think I know what I'm supposed to do.
Hmm.
And maybe if I ask questions, as humans, we're interesting, right? If I ask
Yes.
questions, they might think this or that, and I'll fake it till I make it. No, people should not have to fake it till they make it. So we need to, again, intentionally have training and tell the new leader what is expected. What do we expect from them? And we need to go back and do it with some of our leaders who have been in that title, having that title for years, if we have never done it.
Hmm.
So those are all some things that we need to do. And then we need to be consistent learners,
Yeah.
right? We have to know what's there, what's in the research, what is it saying, what's going on, what's the best evidence, who's doing it well, right?
Yes. Yes. Who's doing it well?
Yeah. Don't
Yeah.
re- don't I am not one for recreating the wheel, right? You, Leanne, you have a wheel going. Let me come and talk to you, see how you got that one going, and maybe we can even make it better, right? So that's really where some of the places where we have to go now and understand what it is that we're aiming for.
Yeah. Yeah. It's like a breath of fresh air to hear you talk, because these are all the things that I also feel like, these, when we're all learning together and nobody is trying to say, I know more than you do, or I think that the people I've learned most from, especially when they were precepting me, were those people who were asking me questions, to find
Mm,
out partly where I was, but also because there were times when I would work. I trained in one state and then worked in another state, and I found out, that things were very different. We may be
right.
looking at exactly the same thing, but we call it two different things, and so we're not communicating about what it is we're dealing with. But yeah,
That's
getting that feeling of not being looked down on, but looking like
yeah.
you're somebody I want to, bring along with what I've learned, but I also want to learn from you. So not everybody is a teacher. How do you deal with people who get into a position where because there aren't enough people on the floor to precept or whatever, they get put into a position where they're precepting, but it's maybe like the worst thing, they don't want to do it.
Yeah, that's a reality that we're facing, and I think because of our current situation with the criticality of the nursing shortage, a lot of hospitals, including ourselves, are facing that. Where before, I'm sure you remember, going to say back in the day, you couldn't even precept till you were a nurse 5 years. That was like the time
Now
frame.
you can be a charge nurse when you've been 6 months.
Well, it's unfortunate that this is where we are, but that's a real side effect of the pandemic, or effect of the pandemic. Where a lot of our experienced nurses with the 30-year experience and so on, those who could retire did, and still are retiring actively now. So we do have a new normal. We do. We are in a different place. So it's really for us to figure out, okay, this is where we are. So what's the best way for us to handle this, right? So we do have to sometimes change course from the way we were going. We were doing some things in silos that no longer can be in silos. There's some things that we're going to have to systemize now because we can spread it across a wider range because we just don't have the sufficient manpower to be able to do it in each location. We have to look at different models of care. You have the blended model, which used to be called team.
Yeah,
Um,
I've been around long enough that
yeah,
they go around and they come back with a new name, but it's the same thing.
right. But you have a lot of RNs and managers who have never worked with,
Mhm.
they've only worked with an RN staff,
Right.
and the PCT or nursing assistant as support. They have never worked with an LPN. So we have to even train the managers on how do you work with an LPN? What can an LPN do? And what can't they do? And I'm here to tell you, it's very little that they can't do, in
Can't
the
do.
that they cannot do. They
Cannot.
can do most everything once they're trained. And as any nurse, right? You got to be competent, deemed competent to do it. So those are some of the things that we're doing, and having the leadership training that we have Leadership Development Institute sessions, of which is an all-day education session, about 3 to 4 times a year, to really, and this ensures, and it's all the nurse managers and directors at assist for the system, so everyone is hearing the information the same time, so it's not, it decreases the opportunity for variations because we all agree this is how we're going to do it. But it's also great because the managers get to meet other managers from,
Right.
because we have 7 hospitals and about
Yeah.
11
Some
clinics.
best practices comes up. This worked for
Exactly.
me. Tell me more about that. It isn't working for
Right.
us. Yeah.
Right.
So we just have a few minutes left, and I just really want to. I mean, you are already supplying some of the things that need to change going forward. Um, do we need to relook at nursing? Um, well, you mentioned education. I think um, what I've heard you say is that education is going to need to change. We need to be maybe more integrated with hospitals and schools. One of the criticisms that I get a lot from people is they see that nurses are being pushed to go to the next level of, go from BSN to MSN to, doctorate to whatever else it is, with very little experience in between. What are your thoughts about that? Do you
Yeah.
think?
Yeah, I wouldn't say nurses are being pushed towards that. I think the BSN, the BSN is pushed or highly encouraged because that is the level of nursing. But I wouldn't say people are being pushed, you know, encouraged, towards the BSN. And if you want to go into a formal leadership position, encouraged towards the masters. But I do have to say for the schools that I work with, University of Miami and FIU, they have, and also um, Miami Dade Miami Dade College, they actually have an advisory committee where the CNOs from the hospitals
Oh,
that support those schools, where those students come to the hospital, where the partnership, I should say, where there's a partnership. There's an advisory council that we all belong to. So we go probably twice a year, sometimes more often, meet with the school, and talk about, they share the curriculum with us and tell us what's going on, and we give input as to what we're seeing on this side. We hold a meeting with the faculty from the schools. Frequently, probably twice a year, we hold it at the hospital. So they come and we talk about our expectations. They tell us, there. So we are doing a lot to ensure that for the next generation of nurses. And there's something else that I have that I call, instead of nursing students, now I'm calling them future nurses.
thank
So
you.
so we talk about what is it that we need for our future nurses in order to because the school want the same thing we want. They want their students to be able to get a job and be successful, and
in
so do
that
we.
job.
So yeah, so we do have a good partnership with that, and that's something that I'm very thankful for.
As we're kind of finishing out here, is there anything you want to make sure that nurses hear from you, especially in this Nurses Week? What if there's any one thing you'd really like to communicate, what would that be?
One thing, nurses, you are dynamic, you are special, you are the best of humanity. You have the power and you hold people's lives in your hands. You are trusted, and always, always honor that trust and know that when people come to you, when you see them, they're at their worst, they're the most vulnerable, they're scared, and you have the power to allay that fear, to let them know just by a touch of your hand, just a touch on their shoulder, that it's going to be okay because you're going to be right there with them. We
Yes.
have to continue to be the advocate for our patients. That's why we're in this profession. You're not here by accident. You're meant to be here. So always honor the trust of your patients.
That's
And happy
beautiful.
Nurses Week.
That's beautiful. I wanted to end with a quote from my favorite poet, who his name is Daisaku Ikeda, and he is from Japan. He's now currently 95 years old, has worked his entire life for peace. And so what he says is, we are able to develop a great life condition to the extent we struggle with our problems and pray deeply. Let's brim with an indomitable spirit and advance with a tenacity of purpose.
Mm,
Say that's where we need to go as nurses.
yes, yes, I like that. You could share that one with me. I like that.
Thank you very much for being on the show. And I know you're going to be at the Power Up Nursing in Orlando, June
Yes.
22nd to the 24th. Do you have any message to nurses about coming to share that with us?
Yes, nurses, come and enjoy with us. Come and learn here with our minds and our hearts. Come and get your cup refilled. You definitely will do that. And I am looking forward to seeing you all there. When you see me, please come up and say hello, because I'm going to do the same to you. So looking forward to seeing you in Orlando.
I am so excited about it, and especially to be able to finally meet you in person. That will be wonderful.
Yes, yes.
All
Me
right.
too.
Thank you so much. And I do want to thank also my producer today and every day that I'm doing this is Tanya Abreu. And she has made doors open 1,000 different ways for this show. So this is Once a Nurse, the original. And we hope that you will continue to watch these programs and even previous programs by going to onceanurse.com, or contact me if you have questions, Leanne at onceanurse.com. Thank you.